Hi, this is Master Anatomy Platform. I'm Zion, and I will take you on this lecture on the fascia compartment of the hand. The outline we'll go through is the hand, the fascia, the compartment, and some clinical correlates. So the hand, being the most distal region of the upper limb, is also called manus, and I believe it has something to do with it being the manual part of the upper limb. It's usually divided into three parts. That is the carpus, the metacarpus, and the phalangeal region. So here is the carpus, metacarpus, and phalangeal region. So the hand is covered and compartmentalized by several fascia, which we'll discuss in the next slide. So we'll structure this lecture on the fascia of the wrist, fascia of the metacarpal region, and fascia of the phalangeal region. And I also need to indicate that some structures in the hand are fit to be called fascia histologically, but some academics prefer not to call them fascia based on their location and based on their function. So histologically, they contain mainly collagen fibers because they are connective tissues, and they are different because they have different location and different functions. The reticular down to the digital sheath and so on. So the fascia of the wrist now. Now the wrist is that most proximal region of the hand, which is distal to the forearm or the antebrachial region. And the fascia in this region is the flexor retinaculum, also called the transverse carpal ligament. Now this fibrous band, in which I am indicating here right now, is the flexor retinaculum, which has its medial attachment at the hook of the hamate bone and the pisiform bone. It then extends laterally to attach the trapezium bone and the scaphoid bone, which has the bulk of its lateral attachments. Now the carpal bones form an arc, which is converted into a tunnel by the flexor retinaculum. Now this is called the carpal tunnel. So the carpal tunnel conveys 10 structures, 9 of which are tendons, and one is the median nerve. These tendons are the 4 flexor digitorum superficialis tendon, the 4 flexor digitorum profundus tendon, and 1 flexor pollicis longus tendon. And then the 10th structure is the median nerve. Now, a compression in the median nerve caused by the swelling of the tendons will cause the carpal tunnel syndrome, and it is characterized by paresthesia, tingling and numbness of the region innervated by the median nerve, and it may even lead to neurodegeneration of the median nerve. So the flexor retinaculum continues with the volar carpal ligament, the palmar carpal ligament. Now this ligament is the thickened inferior end of the antebrachial fascia. Now the antebrachial fascia, remember, it invests the antebrachial region, and this is the volar carpal ligament, which has its continuity with the flexor retinaculum and the antebrachial fascia. So the third is the extensor retinaculum, also called the dorsal carpal ligament. Now this ligament is illustrated here. It is relatively less thickened as the flexor retinaculum, and it is continuous with the volar carpal ligament, its counterpart. It's the thickened inferior end at the dorsal region of the wrist, the thickened inferior end of the antebrachial fascia. Now it's dorsal to the wrist, in contrast to its counterpart, that's the volar carpal ligament, which is anterior to the wrist. Now, by attaching at different regions to the distal ends of the radial and ulnar bone, the extensor retinaculum forms 6 compartments, and it binds the tendons of the extensor muscles in these 6 compartments. It's very necessary to check out our lecture on the muscles of the hand to understand and to get familiar with these tendons and these muscles of the hand. Now, as I've clearly stated, that there are other structures that are fit to be called fascia, which include the synovial sheath and ligaments and ligaments, etc. Now, the fascia of the metacarpal region and the digital fascia. Now, this includes most prominently the palmar aponeurosis. This being the palmar aponeurosis is a thickened triangular fascia that invests the palm, and it is divided into 2 lamina, that is the superficial lamina and the deep lamina. The superficial lamina binds to the palmar skin, that is the palmar integument, and the deep lamina divides into 4 digital slips on its distal course. Now this is the apex of the triangle and this is the base of the triangle. So on its distal course, it forms the digital slips, which are bound together by the transverse fasciculi. This is the transverse fasciculi. And then they continue distally, dividing into 2 to bind the digital fibrous digital sheath, which extends throughout the phalangeal regions. And the palmar aponeurosis above the thenar compartment and the hypothenar compartment are thinner than the palmar aponeurosis. So they are thinner in this region, and being thinner, they form the thenar fascia and then the hypothenar fascia. Now the second here is the superficial palmar fascia. Now this fascia is a fibroareolar fascia that binds the palmar aponeurosis to the palmar integument. So this is the superficial palmar fascia. So the third here is the deep transverse ligaments, which connect the ends of the second, third, fourth, and the fifth metacarpals together. So illustrated here is the deep transverse ligament binding the ends of these metacarpals together. And then we have others such as the synovial sheath and the muscular fascia. So the synovial sheath, such as the synovial tendon sheath of the fingers, and the muscular fascia, such as the muscular fascia of the lumbrical muscles and muscular fascia of the adductor pollicis longus, or adductor pollicis muscle. Now I illustrate here that the fascia also forms muscular fascia and several septa, contributing to the division of the hand into compartments. Example is the lateral fibrous septum. Now this is the lateral fibrous septum, extending from the palmar aponeurosis to the third metacarpal bone, then the medial fibrous septum, extending from the palmar aponeurosis down to the fifth metacarpal bone, the thenar fascia investing the thenar compartment, the hypothenar fascia, also invest in the hypothenar compartment. Several other fascias includes here are those that are not mentioned in this illustration. So finally, we have the fibrous digital sheath. So the fibrous digital sheath invest tendons in the fingers, two tendons in the fingers and one in the thumb. The two here are the flexor digitorum superficialis and the flexor digitorum profundus tendons in the fingers, and in the thumb we have just the flexor pollicis longus tendon. So these are the fibrous digital sheath extending throughout the digits. And remember, it's a continuation of the digital slip that bifurcates from the palmar aponeurosis. So you probably wonder, what's the significance and importance of this sheath and the fascia in the hand? Number one, this fascia reduce friction between tendons and tendons and other structures. The second one, some of the fascia act as lever to increase the motor efficiency of the tendons and the muscles. And the third one, the compartmentalize and support structures such as the flexor retinaculum supporting the flexor tendons and the median nerve. So congratulations, we are now in the second part of our lecture, that is compartment. So the dorsal wrist compartment, also known as the extensor tendon compartment, the compartment in the wrist region, and it's denoted numerically into 6. It is formed by the attachment of the extensor retinaculum on the distal end of the radial and the ulnar bone. So the grooves formed on this bone, on the distal end of this bone, attaches to the extensor retinaculum to form these tunnels. Now you can check out the lecture on the muscles of the hand at Master Anatomy platform to have a good grasp on the names and functions of these tendons. So we move to the compartment in the hand proper, and this includes 11 separate compartments which are classified into 5 for simplicity's sake. Now this is the thinner compartment containing the thinner compartment, the bulge proximal to the thumb, containing the abductor pollicis brevis muscle, the flexor pollicis brevis, the opponens pollicis brevis, and the thinner space, the green space lateral to the lateral muscular septum is the thinner space. Now the second is the hypothenar space, which contains muscles of the digiti minimi, and it doesn't have any space. It's just a compartment. So the third here is the adductor compartment. The adductor compartment contains the adductor pollicis muscle. Now this is the adductor compartment. The purple compartment is the adductor compartment. The second is the mid-palmar or central compartment. Yes, it is central, and anteriorly is the palmar aponeurosis. Laterally is the lateral muscular septum. Medially is the medial muscular septum. And posteriorly are the lumbricals and the metacarpal bones. So the contents of the mid-palmar compartment is the 9 flexor tendons and the median nerve. Then we'll move to the interosseous compartment, which contains 4 dorsal interosseous compartments and 3 volar interosseous compartment. Now the red spaces are the dorsal and the ventral interosseous compartments. Now beautifully we've completed the compartment of the hand, and now we move to the hand spaces. So these spaces are formed by fascia, and they are important as they get distended with pus when there is an infection in the hand. So the hand spaces are different from the hand compartments. So now we are the examples of the hand spaces. The first is the mid-palmar space or the central space. It is bordered laterally by the lateral muscular septum, Now this is the lateral muscular septum, medially by the medial muscular septum, anteriorly the 9 flexor tendon, the median nerve, and the superficial palmar artery, the superficial palmar arc, then posteriorly the palmar interossei fascia. Then the thinner space is bordered medially by the lateral muscular septum and laterally by the fascia and the adductor pollicis muscle. So anteriorly, the digital nerve and versus for 1.5 of the digits, and then the flexor pollicis longus tendon. So we have the third space, which is the space of Parana, and it's an intermuscular space at the distal forearm. And the fourth, is the lumbrical space that surrounds the lumbrical muscles, although their bulk is medial to the second, third, and the fourth lumbrical muscles. This is the space of Parana, and these are the lumbrical canals or lumbrical space, which are continuous with the mid-palmar space. So now we move to the pulp space. Now this space is present at the distal phalange posterior to the skin. So I'd like you to quickly do something to pinch the pulp region in your index finger and the concavity, the central concavity of your palm. You will notice the pulp space is more compact than other regions in your hand. Now this is due to the fact that there are several small septa present at the pulp space. So we move to the anatomical snuff box. So this snuff box is of surgical importance, and it is bordered by the extensor pollicis longus tendon, the extensor pollicis brevis tendon, and the adductor pollicis longus tendon. Then other spaces in the hand region are the dorsal subcutaneous space and the dorsal subaponeurotic space. So the spaces are significant to contain pus. Now the spaces get distended with pus, causing pain, and if not treated well, the pus may transfer the infection to other spaces in the hand. So unlike other spaces, the pulp space, as I said previously, is restricted by the presence of septa, and it restricts the distension of that space, so causing compression of the pus and subsequent increase in pain. Now this is called phelon, and this is a common infection causing abscess in the fingertips. So we have the Dupuytren's contracture, which is characterized by small lumps, skin pitting, and nodules. It's caused by the thickening of the palmar aponeurosis. So now in compartment syndrome, there is also facial increase in pressure. So there are increase in the pressure in the compartment, causing irreversible nerve damage and sometimes muscle damage. Now, this muscle and nerve damage is caused by decreased blood perfusion, and it can be treated by fasciotomy, that is the removal of a part of the fascia. So we've come to the end of this lecture. Ask your questions, send us a mail, and we'll answer as soon as possible. Attempt the quiz on Master Anatomy platform. Like our YouTube page to be informed about new lectures we'll be uploading, and check out the lecture on the muscles of the hand. Thank you very much. And in case you want to study more on this topic, these are my references. Thank you very much, and stay curious.